2, 1, and hold. Left.
Good morning. I'm Mayor Donnie Tuck. I know that a number of you are tuning in expecting to see a presentation on our budget priorities. However, because of the evolving situation of COVID-19 in our community, in our region, and across our country, we thought it'd be better suited if we bring you a presentation about what our community is doing to respond to COVID-19. I'd like to begin by introducing you to our emergency management team. It's our City Manager, Mary Bunting, our Police Chief, Terry Solt, our Fire Chief, Jason Monk, our Emergency Management Coordinator, Reesign Walker, and our Communications Specialist, Robin McCormick. And what we will do is we will have a presentation about the things that we are doing, and then we'll also take questions from our audience. We'd like you to understand that we have a limited time for this presentation, and we'd like to make sure that your questions are pertinent to the discussion at hand. Thank you.
Good afternoon. I'm going to first invite the City Manager, Mary Bunting, to give us an overview of what the city is doing in the wake of the coronavirus. Mary?
Thank you, Robin. I want to begin with stressing that the city team has been planning and working on the coronavirus situation ever since we first learned that it was likely to become a worldwide pandemic. And even frankly before that, years ago, we developed pandemic plans for such an eventuality. So when we first learned about it, we asked our department heads to pull those plans out, dust them off, make sure they were current and based upon the current Virginia Department of Health and Centers for Disease Control, CDC guidance. And we have been doing that for several weeks now. So we're behind the scenes working every day, making sure that we are planning for the health and safety of our community insofar as we reasonably can do so. As you know, late last week, we decided to close city buildings, public buildings, to the general public for 2 weeks. We will revisit that 2-week period on a rolling basis if the guidance from the Virginia Department of Health or CDC asks us to extend longer. We will certainly do that. But just because we're closed to the general public does not mean that your city officials are not working. Actually, every one of our employees, unless they have their own unique situation relating to medical needs or otherwise, are showing up at work and diligently working to continue the business of city government. We will be picking up the garbage. We will be taking care of our roads. We will be responding to police fire calls. We will be processing financial assistance applications or renewals. Everything you would customarily expect us to do, we are planning to do as long as we possibly can. The reason we did close public facilities is that the health department guidance is that we should all be doing everything we can to practice social distancing so we can flatten the curve of the coronavirus. And you're hearing a lot of that in the public right now, flatten the curve. What does that really mean and why is that important? The coronavirus is a virus which will ultimately impact all communities throughout our country. And while it may have minor inconveniences for most people, there are populations, particularly the elderly or those who have underlying ailments, whether it's cancer or chronic respiratory illness or other kinds of chronic issues, they can have a very severe reaction and they often end up in the hospital. And we need to make sure our hospital systems have the available beds, whether they're normal beds or ICU beds, have the available beds available to take care of those who have a severe reaction as well as those who have other medical conditions during this time, say someone who has a heart attack. And if we are all flooding the health system at the same time because we haven't practiced social distancing, then we may have unfortunate outcomes for people that don't really need those. So the goal here and everything that we're doing locally, statewide, and nationally is to try to slow the spread of the disease so that we flatten the curve so that our hospital and medical systems can handle those who need medical care, again, whether that's coronavirus related or whether it is some other normal ailment that befalls them at that time. So that's why we're taking these extraordinary actions and asking people to really social distance as much as possible. You've heard those guidances vary over time. We started with banning large public events, and now we're doing things like canceling unnecessary smaller meetings so that, again, we don't put people at risk. So that's a high-level overview. Again, we look forward to answering your questions today and really trying to provide the best guidance that we can.
Thank you. And since you mentioned medical response, I'm going to ask Chief Jason Monk to tell us what fire and EMS is doing now.
Thanks, Robin. Fortunately and unfortunately at the same time, we've dealt with such instances of pathogenic bacteriology within the city, and we have policies and plans in place to deal with that. Most recent was the Ebola outbreak, which allowed us to ramp up our procedures and our plans and policies. Now, this is a new one, and one that we had not seen before, so this has posed challenges for everyone in the city, including our providers. And of course, in my opinion, our employees are our greatest asset, and without them being healthy, they can't provide the services that we're expected to provide. So we have policies and plans in place. We have proper PPE that is stored and on our ambulances. We're taking precautions along with the city to stop the public visits from the fire stations. And it's certainly not because we don't want to see the public come in. That's one of the great joys of being in the fire department, is seeing our citizens come in, including the children. But if we are going to do our part in practicing social distancing, this is extremely important. And if you've read anything online, those things that are from credible sources about social distancing, it does work. But it requires everyone to do their part. So fire is poised and ready. We are working closely with our partners at Centera, Riverside, and Bon Secours to make sure that our efforts are collective along with our healthcare provider efforts, because if we're not in concert, they can easily be overwhelmed, much like fire can be overwhelmed. But our providers are working and taking measures to make sure that they can still answer the calls as quickly and expeditiously as possible. You may see some minor changes in our responses, but that is to help with this entire social distancing process. But when you call 911, you're still going to get us to respond.
Thank you. I'm actually going to direct a question that we've gotten on Facebook now from Eddie to our Emergency Management Director, Wisan Walker. He wants to know if there are any known cases in Hampton.
At this time, we have no known cases that I am aware of in the city of Hampton, but we do have cases, 15 confirmed cases and 2 deaths in the region.
And I think it's important, Wisan, why don't you talk about the potential for community spread and why we have concerns even if we don't know if there are cases right here.
So at this time, we really are looking at possible limited community transmission, hence all the precautions that the city is taking to promote social distancing and trying to encourage residents and everybody to, stay apart from each other a little bit. You know, the way we do things nowadays, don't handshake, don't, encourage each other to hug or things like that. We really want to limit transmission of the virus should it be here in the area.
And just to be clear, community spread means not husband, wife, not somebody I went to dinner with, but we don't know how this person got it somewhere.
Yes. Community spread really is the cases that are confirmed are basically, we don't know, the Virginia Department of Health does contact tracing of folks who are confirmed, and so when they don't know how the person contacted the virus or contracted the virus, that is community spread. A lot of the cases are travel related to high risk areas that the state has been looking at, but we do have some in the region that they are still tracing and asking questions and things like that, hence the guidance from Virginia Department of Health to social distance, and that's to protect everybody.
Okay, Mary, we have a question from Christine who wants to know if price gouging on tissue paper, sanitizer, and basic items of necessity can be addressed in the city.
I wish we had the ability to do that. Virginia operates with what's called the Dillon Rule, and what the Dillon Rule means is that localities can only enact legislation or actions that are specifically granted to them by the state or through their charter. So price gouging, as an example, would be something that we would look to the state or the nation to address. We're also, of course, hoping that retailers will take the responsible actions to ensure that that does not happen. I will just take the moment to say we've also had a lot of other great suggestions. For instance, the mayor received a suggestion the other day from a resident who was suggesting that we have grocery stores open an hour early for just the elderly or vulnerable populations. And as much as we think that's a great suggestion, we don't have the ability to mandate that. We can suggest it, and we do. And in fact, I've seen some reports that some stores are starting to do that voluntarily. But our powers are not always as extensive as we might want. And the price gouging and the store hours and those kinds of things are things we can only sort of address through influence. But we do our best to do so.
We haven't heard from Police Chief Terry Salt yet. Chief Salt, do you want to give us an overview of what police are doing?
Yeah, we're working hand in hand with emergency management and with the fire department. And Chief Monk did a really good job of explaining some of the preparatory actions that we're taking. We'll say that the PPE, personal protection equipment, every officer is trained on bloodborne pathogens, airborne pathogens as part of their general training. They're given the protective equipment that they carry with them every day, even before this outbreak. Now we are augmenting that equipment with additional equipment to make sure that we have the depth of equipment necessary to cover the more use or the increased use of such. So as a result, we're refreshing some of that training. We're doing a number of things. We're very much looking at social distancing, and we're one profession that doesn't really have a choice sometimes on the social distancing. But in the day-to-day routine business that we do, we're going to be doing a number of things. Our building is closed to the public, but we also recognize that our citizens have to conduct some business with the police department. Some of the things are records requests and that sort of thing. We're setting up an ability to perhaps do that online. That should be in place very soon. But when you call the police and you need a police officer or you need to report something, you will find that you will be referred a little more frequently or more frequently to have the officer take the report over the phone unless there's a need for the officer to come to the scene to gather evidence or to take some type of police action to protect property or people. The other areas that we may need assistance in is the areas of property and evidence where property has been found or evidence needs to be returned. We can do that by appointment. And also the courts have suspended the fingerprinting requirements of the court-ordered fingerprinting. We have stopped that until we'll reassess after about 2 weeks to see where we end up with it. The big one is accident reports. We're going to facilitate that through electronic means and getting your car back after it's been towed from a wreck or something along those lines. We have the ability to do that in-house as well. We will work the way that we normally work after hours. So you would come to the police department if you need to get a tow sheet to take to the wrecker company to pick up your vehicle. You'll be allowed, one person at a time, be allowed to come in, and they will go to the slot there where the records attendant will give them that slip. At the end of the day, it comes to how we respond to calls for service. When you get out to, you call for an officer to come and to take an in-person report, the officer may do a couple of things that are a little different. They may ask you to step outside to where we can keep the social distancing and we don't unnecessarily expose officers to what may or may not be in the home. You may find that the officer may stand back. We're going to try to keep that 6-foot distance to protect both the citizen and the officer. We're just following the general guidelines we expect everyone else. The simple things, the sanitation of making sure we have hand sanitizer and cleaning surfaces and things like that, we will continue to do.
Okay, thank you. Mary, Paul wants to know, why is the beach still open?
So the health department guidance at all levels is that it is not unsafe for people to be outdoors. It's very easy to maintain social distancing outdoors, and not pass on infection inadvertently. And it's important, especially as we have children and increased adult isolation for just teleworking reasons or those kinds of things, that people be able to get outside, get fresh air, maintain their mental health, and maintain their physical health. And so we want to continue to make our facilities available so long as the health department guidance is that it is safe to do so. Now, I will say there's some things we have closed. Because, and I'll use an example. A golf course is something that we did choose to close for a couple different reasons. Once you're on the golf course, yes, it would be safe to be out and maintain social distancing, but you'd have to interact with someone to rent your equipment. And during the day in particular, we have a customer base that tends to be a little older and falls into some of those vulnerable categories, and we don't want to send mixed messages to our public, and so we felt it was prudent to close the golf courses, our community centers, our senior centers, those kinds of things. But basic outdoor recreation, again, where you can have social distancing, you're not in a team environment, that all right now is deemed very safe.
So what about the public restrooms at the beach and playground equipment?
So we are, as I mentioned earlier, all of our employees are working, and we are maintaining deep cleaning practices for things like the restrooms and the playground equipment, making sure that we have staff on site to do that on a very frequent and regular basis.
That said, I think we should say that anyone who doesn't feel comfortable should not go.
Right.
You know, use your best judgment and guidance.
Absolutely. They are optional recreational facilities. If I might, before we go to the next question, since I brought up children being out of schools, I really want to give a shout out to our Hampton City Schools, which has done a phenomenal job in preparing for the 2-week closure that was ordered by the governor. They were not only well positioned to provide instructional packets to our students, whether they're elementary school students where those needed to be picked up, or whether they're middle and high school students where they can be delivered through their one-to-one Chromebook devices. But also they were very prepared and ready to go with food services for those students who depend upon their free or reduced lunch and breakfast system. And in fact, Hampton City Schools was one of the first school divisions to announce those plans. They were operating yesterday with those services, and we're just super proud of our school system for thinking about the whole child every day, whatever it takes.
And while we're on you, or maybe this is Wisan, Nicolette wants to know about the homeless or vulnerable people who could be facing eviction.
So I think I'll take that. Again, we're not legally in the position to work with landlords or others around issues of eviction. We are hoping that all businesses, whether they're restaurants, grocery stores, landlords, what have you, will work with people who have urgent needs relative to this situation. But we can't mandate, for instance, landlords don't proceed with an eviction. Now, that said, the courts are going to be closed for all but essential court cases, so that may impact some of that. But more specifically to the homeless and other vulnerable populations, our Department of Human Services continues to operate. They have a multiplicity of divisions. They work with adults who need protective care, children who need protective care, as well as the homeless. And so we do have homeless providers that provide day services, and if there are homeless that are in need of night services or what have you, we're working with them on a case-by-case basis to address their needs.
All right, this next question, I'm not sure if we are able to answer, but I'll call on Wisan to give whatever it is you know. The CDC guidelines for testing don't seem to allow us to understand the full extent of this virus. When can those who are sick and may be exposed, but not within the CDC guidelines, be tested?
Actually, I will have to defer. There is a VDH call number that we can get in a little bit, or do you have that, Robin?
That is. And so specific questions about health should go to the Virginia Department of Health. That is 757-594-7069, and that hotline is staffed from 8 a.m. to 8 p.m. every day.
But if I could follow up on that, one of the things, to continue just social distancing, community spread, just encouraging everyone to practice good hygiene and everything, and wash your hands. Some simple things like that. Wash it for 20 seconds and everything. Dry your hands. Don't touch your face, your nose, your ears, and then, touch again. And it's very easy to do that without knowing. It's very subconscious. We touch, very often, but really trying to work on those practices is one way to prevent that community spread. Chief Salt had mentioned social distancing of 6 feet from folks when you're talking to them or out trying to do that. It's strongly encouraged and everything like that. And if you have to sneeze, sneeze into a tissue, throw it away, wash your hands again, things like that. If you don't have water and soap close by, hand sanitizer is good to use if you can do that.
And I think the CDC is recommending your primary care physician is your first line of defense. Call that person. Don't try to guess what the CDC guidelines are. Call a health expert and get some advice on what you should do.
Yes, and then also make sure, there are a lot of people that are teleworking, or even if you're out and about in your work area, please just, wipe it down, clean it, make sure it's as clean as you can make it.
All right, Chris Jacobson wants to know if we have liaisons with Centera, with Langley, with Public Health to keep people up to date on what the testing rules are and what we're doing.
Absolutely. We are in great contact with our Centera Health system. In fact, just before we came online, I was speaking with the president over there about some preparations that they're going to be taking in our community and the logistics behind those. We actually have a full-time liaison that works with the military every day, not just in terms of crises like this. And we have invited Langley Air Force Base, as well as all of our federal partners, NASA, Langley, and others, to be part of our emergency management planning process. And in terms of the Virginia Department of Health, we have multiple times a day communication with our local district.
Okay. Now, this is one you probably can't answer, but you can explain why. Ghana wants to know, as college students return home and are doing online learning, is there any way that they can get free or expanded access to the internet the way Cox gives that program to K through 12 students?
Yeah, I wish I had an answer for that. And I don't. Again, this goes back to the private sector enterprises and what they're able to do and willing to do. I think that is a question that if someone has that particular need, they should direct to their local provider. But we will be glad, again, through our inquiries with businesses, to pass that concern along and ask them, are they willing or have they considered doing similar opportunities for college students?
All right, and speaking of businesses, Flip wants to know if we're in contact with local businesses to communicate to them that they should limit the number of patrons at any one time or switch to takeout or delivery. I think he's speaking of the restaurants here.
Yes, we have talked, in fact, I had a meeting with our economic development officials the other day, and they are reaching out as they can to as many of our small businesses and local businesses as possible that aren't necessarily getting national chain guidance to make them aware of a variety of things. In addition to what they can do, such as move to takeout and delivery options to stay viable, we're also talking about with them the availability of small business administration, low interest, no interest loans to help them get through this, talking with them about, brainstorming with them about things they can do to ensure that hopefully they're there for us through the duration of the crisis and can return to viability. We do have a lot of businesses in our community and a small economic development staff, so if you're one of those businesses out there that have not yet been contacted, please don't think it's that we don't care about you or have you on our radar screen. We're making those contacts as we are able.
All right, and speaking of which, I'm going to phrase this as a suggestion, just so you all know. Flip suggests that while the schools are closed, maybe if necessary, one or more could be converted to an emergency hospital type thing.
We have looked at where we would go for emergency hospitals if we need to do that, and I will say our absolute preference is to avoid the school systems because we want our school systems to be able to return to instructional delivery as soon as possible, and by keeping them closed and having done deep cleaning there, we will be able to open them up right when the order to return to school is lifted. If we have used one or more of those as hospital sites, that would take longer for us to return to normalcy for our students. And so unless that became an absolute measure of last resort, we would likely not do that. But we do have other public facilities and private facilities that we could use as additional hospital space should the need come. And that's where, again, our coordination with our local hospital systems comes in handy. I prefer not to announce those sites for obvious reasons.
And I think, Wisan, it would be fair to say that you are in frequent contact with Centera and with other facilities, and you know that they're working on plans, and they have plans if they do need additional.
Yes, we are in constant contact with the hospitals, and Chief Monk is also part of that planning and things like that. So we do have a group working should the need arise.
Okay, and Jeff wants to know, if you don't feel well and it's cold symptoms, what should you do? Should you go to the doctor? Should you go to the hospital? Should you go to patient first or a similar open place?
Let's have maybe Chief Monk. Do you want to do that one?
Well, yeah, I can't speak on behalf of the Department of Health, or obviously I'm not a physician either, but the CDC provides very specific guidelines on what you should do if. I know what I might do, but I may be different than the general public. But it's very specific on the types of symptoms that you're experiencing, with the dry cough, the fever, the shortness of breath. Those are the three top ones that are significant with COVID-19. It also, and if you're a member of Facebook, certainly there are several infograms up there that show you the differences between a cold, a flu, and COVID. So I would pay attention to that. But if you have any questions at all, certainly call your physician with those symptoms. And as we always say, if you feel like it's an emergency, dial 911 and then we'll come and assist you. But try not to overload your healthcare facilities if you don't need to. As you can imagine, that's happening now. And when you overload the system, those that actually have serious health issues are having to wait, or there's delayed treatment. So best advice is contact your physician. If it's an emergency, dial 911.
Exactly. Thank you very much. Melanie wants to know about HRT and transportation services. Mary, I know you have liaisons with HRT. It's not a city-run operation.
Correct. Yes, and I have to say I have not heard any changes as of today. They are doing all the proper deep cleaning of their assets. There are systems throughout the country. I know many of us woke up to news today that the San Francisco Bay Area was going to a more formal stay-in-place kind of procedure and policy, but they were maintaining the transit systems so that people that had to go to work could go to work. I can't speak for William Harrell. I'm sure he's going through some of the similar analysis, but they are absolutely increasing their deep cleaning procedures and balancing, the safety of people, but the need for people to get to work. And so HRT questions specifically should be directed to HRT. They do not work directly as in our employ.
And I will say, you can certainly follow their Facebook page, or if they have announcements, you can go to hampton.gov. We will repost those, and we will reshare them on this Facebook page as well. Christopher wants to know about, will the cost of testing for city employees be covered?
We are working through that with Anthem right now. They are our provider, and they are giving us options, and it is our hope that we are able to make an announcement very soon about that.
Thank you.
You may also have been following federal legislation that's working its way through, and there are some considerations there, and that's part of why there hasn't been a final decision yet about what we will do, because the federal government may just end up making that free testing for all. So we're having to work through the priority following the federal guidance, and then if the guidance isn't there, to supplement that with our own local decisions.
Thank you. Now, you sort of addressed this earlier, but Tara probably just joined and asked about, are the parks closed? So do you want to go through how we're doing that again?
Sure, real quickly again. We are keeping our parks open now because parks are a great place for people to maintain social distancing and yet get out and do physical exercise, mental stress relief, those kinds of things. There are some park-like facilities, like for instance our golf course, which we have closed because there is more interaction. You have to come in and transact business to get your golf cart, get your equipment, etc. And in particular, we have as a customer base, especially during the day, work days, an older population that has been specifically called out as vulnerable. And we did not want to be sending a mixed message to our vulnerable populations. We have, however, closed all of our recreational facilities, like our community centers, our senior center, etc., because again, you're going to get that congregation of more than 10 to 50 people, depending upon the various guidance that we're being asked to follow at any given time. So for now, we want to keep our parks open so people can recreate. And even, as I said earlier, in some of the areas that are doing more direct shelter-in-place kinds of recommendations, they are keeping the ability for people to walk outside and get that fresh air as an option for them.
It certainly can help relieve stress. I will say that. I think we do not have any questions in the queue currently. Wee-san, do you want to talk generally about kinds of preparations or who else you're in contact with at the Emergency Operations Center?
Sure. And like with any emergency, as an emergency manager, we really recommend folks to prepare, like whether it's a hurricane or a tornado. I know this is a little different, but to have a 2-week supply of food and water and things needed for your family. This is a little different. Make sure you have your medications, important papers, and things like that. And you can actually go to FEMA's ready.gov site. There are checklists and information out there so that you'll be prepared for any type of emergency.
And certainly this is different from a hurricane in that you don't necessarily need to prepare to be without water or power. We have no reason to think that is going to be discontinued. So it's a little more comfortable sheltering at home than it might be in a natural disaster.
Yes, I think some of the challenges are, the Wi-Fi or things like that for the children and having activities now that schools are closed. But absolutely, but it's always good to be prepared. It also gives you a peace of mind that you have your ready resources should anything happen.
Okay, and I'm going to repeat again, the Virginia Department of Health on the peninsula has opened a local hotline. It is staffed from 8 a.m. to 8 p.m., 7 days a week, and that number is 757-594-7069.
Robin, if we're still waiting for more questions to come in, since we do apparently have some city employees who are watching, I might just take a moment to talk a little bit about our workforce.
Oh, that would be great.
If that's okay. I want to first stress that our workforce is extremely important to us, not just as an employer, but to our larger community. There are so many things we depend upon our workforce to do for us every day, some of which we don't even think about. And if they're not there doing those jobs, we as a community don't enjoy the quality of life that we typically do. So our goal has been to make sure that our city employees can do work for the public, whether it's telephonically or electronically. So first I want to say to people, just because the buildings are closed doesn't mean we're not there for you. The chief outlined some great examples of what they're doing on an individual case-by-case basis to make sure that the public can transact with them even with the building closed. And every single one of our departments we have met with to see how they will conduct business with the public. But to conduct business with the public, we need the people there. And so we are working with our folks. Each of our department heads, we had meetings yesterday with every one of them to review their plans for teleworking or social distancing of all of our employees. Because I do get the question, if it's unsafe to gather with 50 people or 10 people, is it safe to go to work? It's safe to go to work if we're practicing social distancing, and it's also safe to work in a telework fashion. So the more employees we can get into a telework situation, the more space we have for those who physically need to be at work to have that 6-foot distancing that's recommended. So we really care about all of our employees and want to make sure that we're able to provide those options for them. We want to make sure that they're continuously there for the public so that the public can conduct life as much as normal as possible. And we want to make sure that they're able to count on a paycheck. But to get that paycheck, we of course have to be at work, whether that's distance through telework or whether that's in our sites. So while I won't get into every detailed plan for each department, that's something our department heads are rolling out for our employees. I do want our public to know that we want to be there for you throughout the duration of this event. And we want to make sure we protect our employees, so we will maybe be doing it differently, maybe doing more by phone or more by the computer, but we will be there for them and we will be there for our employees.
Thank you. Go ahead.
Could I use something as a segue from what Mary stated? We throw out a lot of acronyms up here on stage, especially with police and fire, with mentioning EOC, and that's our Emergency Operations Center. And I just wanted to give a quick overview of, there's a lot of things that the public does not see going on behind the scenes. And if you can imagine representatives from every department within the city meeting, but not just that, increase that scale. And I'll give you an example of how the peninsula works together. All 6 fire and rescue agencies on the peninsula have come together to create a joint IMT, another acronym, and that's an incident management team. And one of the things we recognized that actually came out of James City County was that the health department's doing an excellent job with what they're doing, but they needed a little assistance with managing the incident. Well, that's what police and fire do really well. So we came together and created a joint IMT in the Newport News Emergency Operations Center, where we are helping guide the information flow. And accurate and consistent communication is extremely important, especially in cases like this. So our job is to bring all the information in and put out a joint message. So James City County, Poquoson, Newport News, Williamsburg, York County, and Hampton have come together to do that. Chief Salt has a member of his staff that staffs that, as well as fire, so we can help maintain the communication. And we don't operate in a silo, because if a city were to operate in a silo in a situation like this, we'd be doomed. We do very well regionally, and especially on the peninsula. So that allows us to bring information in and bring it to Mary, and bring it to the rest of the city department heads of what best practices are, because no one wants to have to go through this the first time. But what is a good thing is we are learning from our partners on the West Coast and from Italy, lessons that they've learned. We're creating our own best practices, which are allowing us to get ahead of this a lot faster. So when you see the measures that the city manager puts forth or the governor puts forth, I urge you not to be the person that says that's overkill or that's too much. We don't know if that is or not. So we're taking the extra precaution to protect the community. But we're doing it jointly, and we have an excellent system here on the peninsula.
Thank you, and I want to say the communications teams are also working together. Someone like the Virginia Department of Health doesn't have a lot of followers on Facebook, and if you don't interact, even if you follow them, if you don't interact regularly, they're not going to show up in your feed. So I'm really going to encourage people to stick with the City of Hampton's Facebook. We are a verified site. We're going to be putting out the information, and we're going to share it regionally and let everybody know what's going on in the region, and it's going to come from verified sources.
And Robin, this is a good time, because a lot of times people think that with so many different jurisdictions on the peninsula and throughout the whole Hampton Roads region, that there is a lot of individuality and not a lot of regionalism. I want to assure you that, just as you and Chief Monk mentioned, the regional managers are working together. We've had multiple conference calls to try to make sure we're sending consistent messages and acting consistently so we don't confuse people. I know earlier today the regional city attorneys were talking through some of the unique legal issues that come up in an emergency. So that regionalism happens throughout all of our agencies. I know the regional emergency managers and the regional police chiefs are doing the same. And it doesn't just happen in the middle of a pandemic or a hurricane. It happens much more frequently than people realize. But it's times like this that those established relationships really become very critical. And I thank Chief Monk for bringing that up, because it really is important. This virus doesn't know a boundary. This virus is going to be in and around our region and our state and our nation for some time. And it doesn't say the border of Hampton or the border of Newport News ends and starts here. So I think the regionalism that we're exhibiting is really to be commended for all of the localities.
Another thing, Robin, building on something Mary was talking about a little bit earlier, is how do we take care of citizens and employees, and what are our preparedness levels? Well, a lot of the things that we are putting in place that we're talking about now are what we're doing now. But our plans include scalability to where there are other actions should this increase, this problem increase. If it plateaus, which we're hoping that it will, it gives us the longevity to be able to continue through multiple operational weeks to make sure that we have sustainability for these services as well. But scalability is the big thing. When we talk about our employees particularly, because we want them to be healthy. We want them to be healthy when they interact with the public. We want to make sure that we're able to take care of them and their needs. And so there are a lot of plans that are there that we can actually build upon and have plans to build upon should problems increase.
And you have run drills about how we respond in a pandemic. So it's not like this was a total shock. We had no preparations. You guys have been working on things like this for a long time.
Yes, definitely. The region and the locality and City of Hampton, over the years, we do have pandemic plans. We have run exercises. This is a very fluid situation. Plans are there so that we can talk through issues, but there are issues that have arose that we may not have considered in past planning because there were different viruses and different things like that. But with COVID-19, we have dusted off those plans. We've reviewed them. We have updated them. And as we are going, we will have better plans in the future. But yes, we have plans that we can use should something, escalate, or like the chief said, Chief Salt, it can be, gotten larger, smaller, anything that we need to do if we need to expand, or even hopefully it will plateau and we will be able to scale back down.
Okay. Well, Jason wants to compliment you guys on the useful info that is being shared here. And Eddie has another question. Is there a number of presumptive cases or confirmed cases that if we get to, there will be a greater shutdown?
We take our guidance from the Virginia Department of Health at this time to make those kind of decisions.
There's no hard number. We're not sitting on a target or anything.
As far as we know, we're not, but we are in constant contact with the Virginia Department of Health, and as the situation changes, we make decisions based on their guidance.
Yeah, Robin, it's a constant evaluation that's occurring every minute, every hour, every day, and in consultation with all of our partners is when those decisions actually get made.
Similar to that, and I already know the answer, but I want Maya to know we're addressing it, is there a way to expedite the emergency procedure process for individuals who have received notifications that they may have come into contact with someone who's infected? And I'm going to say that's a health department and a health system question, and I'm sorry that we can't answer it, but...
Well, I think what we can address is that there are some plans in place you've seen mobile testing and that sort of thing. There are some plans in place that if we reach that level, that they may be implemented. We can't talk about details. It involves other partners, but let's just say that's part of that scalability that we're talking about with our partners.
And, Centera noted that there were 3 hospitals of theirs that were going to be doing drive-up testing, that they were expanding that, not in Hampton at this time, but we do know that those health professionals are scaling, as you say, to be able to handle more. And the federal government and the CDC is increasing the number of testing kits available, and that is all happening as we speak.
If I can talk 1 minute about one of the things we touched on earlier, and that's the grocery stores and the supply chains. And I've been in conversations with the manager and our whole team about this, and I know it's on everybody's mind. You go to the grocery store, and particularly there's no toilet paper, there's no water, and you've seen some run on the meats and that type of thing. Over the weekend, I stopped at a number of grocery stores, and I talked to not only a couple of the managers, but more importantly, the stock clerks, because when you're in plain clothes, you go in there and you're not in a big uniform, and you just have a casual conversation. And talking with them, there's no problem getting trucks in. They're getting trucks with anywhere from 3 to 5 times the normal supplies. But one of the stock clerks I talked to over the weekend at the new Kroger, he says that, hey, we've got the stuff coming in, we got more trucks coming in. He says, but I feel like every time I go to the shelf and I stock it and I turn around and look at my cart and I turn back around, it's empty. So the reality is that there is a continual supply line. We need to kind of pace ourselves, don't panic. Lisan has already mentioned a little bit about the guidelines. And at the end of the day, it's there if we just don't overreact to the problem.
And I think it's important to note that for the West Coast communities, again, that are a bit further ahead with their cases than Virginia, even again, where they're doing more directives about staying home, they are allowing people to go to the grocery stores. I think what worries people is that they think I'm not going to be able to go there, so I better get it while I can. But there has been a recognition heretofore that even when you're doing more directives about staying at home, that there is a need to allow people to do essential daily living things such as going to the grocery store. Now, I can't promise what the future holds, of course, but I think we can take our lessons because our curve is further behind the West Coast, and the West Coast curve is further behind Italy, and so we can sort of see how this is evolving and try to stay calm as much as possible and rely on the supply chains, which, as the chief mentioned, are not interrupted.
That makes a lot of sense. And it is also thinking about the people around you and the community and how much of that stock you reasonably need right now, and not filling up your cart and buying all the toilet paper, but remembering that there are people beside you and your neighbors who are also doing their shopping.
Absolutely. This is a good time to remember that we're all interdependent on one another, and we need to be thinking not just about ourselves and our family, which is our natural first reaction, but also about our neighborhoods and our larger community and those who are maybe more vulnerable and need extra supports, and or people who are our neighbors, just checking in on them. We can do that telephonically. We don't have to become isolated as a community. There are lots of things that we can do to support one another in these difficult times, whether it's on checking with our family on Facebook, or whether it's picking up the phone and calling them, or just remembering that people are out there who are going through it too, and that we all can get through it if we work together.
Okay. Jill reminds me, because I'll take this one, to make sure we're putting information on Nextdoor as well as Facebook, and we are. I don't think we have the technology to stream live on Nextdoor, but we are putting our bulletins there, and we'll make certain that we continue to do so. Again, this is sort of a partner question, but elderly programs like Meals on Wheels, or if we have elderly relatives or neighbors, are there some particular things that are happening there that we could suggest?
Well, you got a whole sort of continuum of elderly services, all the way from nursing homes, which my understanding is that many are taking measures such as bringing meals to doors as opposed to congregate meal dining, limiting the number of people who come in to visit nursing home residents, all the way to seniors who are staying at home because they can enjoy independent living. And again, a lot of what we're seeing is that in terms of things like meal deliveries, and I'm not speaking for the Peninsula Agency on Aging because I have not had a direct conversation with them, to be fair, but we can certainly drop off supplies, leave them at the door, allow that elderly person to collect the supplies, those kinds of things, if we want to take care of an elderly neighbor, for instance, and yet not expose them to some potential risk. So there are all sorts of means that we can continue to check in on our elderly residents and family members and protect their health at the same time.
Okay. City employee wants to know if the city does extend the shutdown and become more shut down, will employees still be able to work elsewhere?
Our plan, again, I touched on this earlier, but I want to reemphasize this. We've met with each of our city departments to go through what are their options for teleworking and or social distancing if we have particular employees who cannot telework for whatever reason. The goal of all this is to keep our employees employed. I don't think it's responsible for us as taxpayers to pay people to be at home and not work, but I'm perfectly comfortable with us paying people to work and be at home, or work in a smaller setting, in a social distance situation in an office building. And our commitment is that we want to make sure that we have meaningful work for every employee to do so that they can stay employed and we can continue to service the public, whether it's telephonically or electronically, because our public does depend on us. And whether someone is a typical emergency worker, like a police officer or a fire worker or a solid waste collector, or whether they're what we typically call non-emergency essential employees, maybe someone who's doing stuff behind the scenes, all of us are important in a time like this because we need to keep our lives as normal as possible. So an IT worker who you might be able to do without for one day on a snow day is essential in a pandemic because we need to keep those telework options flowing. So really, in something like this, a long duration event, all of our employees are essential, and we want to make sure they're all able to continue life as normal for our city government. That helps them to ensure that they have a paycheck coming, but I want people to know they're going to be working for that paycheck. Even if the public facility is closed to the general public, they're not just sitting at home not doing anything. They are working behind the scenes, whether it's in a social distance situation or a telework situation.
Robin, I'd like to jump in here for just a second because when you think of pandemics, you tend to think of police, fire, emergency services, emergency management. But I'd like to give a shout out to two different groups. One is the leadership team and the other is our IT department. Because the leadership team put out very early a self-assessment for each department head to look at their own organizations. Part of that was to look at, what are our options? How can we continue city services that maybe at that scalability, as we grow that, have the ability to work from home? Well, a lot of that involves technology. It involves how do we make sure we have secure connections to where the work can get done and be justified to work from home. Well, the IT department has really stepped up. The manager over the last day has met with every department head, evaluated these self-evaluations or these departmental evaluations, which includes how many people can use social distance currently in their working spaces, and then how many can you telecommute, and then what equipment is needed. And then the IT department has stepped up to program everything they need to program to make sure that we can make that happen. That just doesn't occur overnight. That's not cops or firefighters on the streets. That's the behind the scenes that you don't see.
Well, and frankly, our finance team and other people, you don't think of them as being necessary in an emergency, but they're going to keep people getting paid. They're going to keep the city's bills getting paid. I mean, there's a certain amount of things that have to happen that people don't necessarily see.
Absolutely.
Crystal has something, I think she's talking about what people need to feel secure that they can go out and get their own supplies. And I don't know how to comfort her on that. Do you have any ideas?
One of the things that we're doing is we're monitoring the crime trends. We're doing a daily review to see how they're comparing to years past. And so we're going to monitor any changes in that. From a safety perspective, from a personal safety perspective, from crime and that sort of thing, there's no issues. It's just another day in the life. From the health issues, I think that's where you monitor and the communication flow that's coming out that we've all talked about, these Q&As, and I really admire the manager's leadership on putting together this discussion because that's where you're going to get your information.
I think Wissam was going to add something.
Yeah, I was just going to ask, stay calm and, continue to practice the good hygiene and things like that. When you go out, go grocery shopping, wipe down the carts. A lot of them have provided the wipes and things like that. And then just keep your social distance. And I've heard, and I know many of you have seen on Facebook or, read, people are talking to people. And, this is something as a community we can all get together and behind. And if we all support each other, I think that will help. And just, working day by day.
That's what I noticed. I took a walk this weekend and neighbors were out. They were working in their yard or whatever, but we were waving and kind of yelling at each other, not so much getting real close together. And you can still maintain that socialization without being really close to folks.
Don't you find it a bit ironic that 4 or 5 months ago we've been talking about people socializing more and getting off the computer, and now we're talking about communicate by the computer. Let's do more texting, let's do more Facebook Live, or do more FaceTime and that sort of thing. Quite interesting, particularly with the kids.
Well, I will say, though, there's nothing like a good crisis to catch up on personal reading, take a time to read a book, those kinds of what some kids might think are old-fashioned things to do, actually are great ways to spend time. Playing board games with families, reconnecting. So yes, while we might need to do the social distancing with the rest of the external world in terms of interacting with city government, it's a great time to do family things, to focus on family, really make the most of the time. So often, as we deal with any crisis, the glass can be either half empty or half full. And while I certainly wouldn't want to say that this is a great opportunity for anything, we all wish we weren't dealing with a pandemic, there are hidden opportunities for us to reconnect, again, like I said, with our neighbors and check on each other, remember that we are a broader community, and in our own families spend time with things like reading books or playing board games or just doing those kinds of things. So it's kind of it's like yes, we need to depend on technology more, but it's a great time while we're isolated to do some of those less technological-oriented things.
We don't have to train the community to do it. It's already there. So it's one of those positives of technology growth.
Absolutely.
And I think, too, pick up the phone. A lot of this generation is used to texting and not necessarily calling, and we can get reacquainted with that practice.
Absolutely.
There's one other group I think that we need to shout out to, and that's our city leadership, the mayor and council. If we were not properly funded in each of our teams, we wouldn't be as prepared as we are today. And I think there has been foresight through the years, at least since I've been here and clearly beyond, to make sure that we are ready for challenges that we face. Of course, we're in hurricane kind of alley, but at the same time, it helps us practice for something like this.
And I do want to let people know, in addition to Facebook, there are other ways to make sure you're getting your news from the city. You can go to hampton.gov and read the homepage under Top News. You can go to hampton.gov/notify-me and sign up to get an email alert or a text when we post a new news alert. You can, for employees, you can go to Employee Connection, hampton.gov/employee, and make sure that you're signed up to get city alerts specific to the workplace. If you want to do that, and that doesn't have to be your work email, it can be a home email or a text number.
And while you're plugging different things for people to stay connected, since this was originally going to be a budget chat, I do want to remind people that in the vein we've been talking about, life goes on. We still are in the middle of developing a proposed budget. Hampton's pretty unique in the fact that we do solicit resident input before we release a manager's recommended budget. In addition to some of the opportunities we had last week, we have an online poll that people can go on and take, and we took this time today to deal what we thought was a more pressing matter, but I do want to encourage people to take the time to go to our website and complete the budget polling, because we really do care, in terms of planning for next year, what some of the priorities for people are. I will say that our revenue projections may have to be shifted because of some of this coronavirus impact. Obviously, tourism is going to be down for a short period of time, and that's going to impact things like sales and meals and lodging taxes. So it's really important that we know what people's priorities are, so that as we have to react to budgetary pressures that may come out of the coronavirus, we are trying to do the best we can to protect people's priorities. So please go to www.hampton.gov/budget, or is it iValue?
Survey.
Budget survey.
Budget survey.
Budget survey.
Yeah, and that will be open through next Monday, because of course we are going to have to close it down, take those recommendations and look at them and prepare a budget. Those things have to keep moving. Denise wants to know, can you talk about safety when delivering food? Are there any special precautions that you know of? I'm not sure who I'm talking to here. Anybody can jump in.
I think when you talk about having food delivered, or if we talk about if you're delivering food, one thing is know who you're delivering to or you're receiving from. Most of the food delivery places now are doing non-contact deliveries. In other words, they will call you the minute they arrive. They place the meal at the door. and a lot of them have tracking locations so you know when they're about to arrive. But if you're doing deliveries, also know who you're delivering to, so you can do that same practice. You don't have to have contact with the individual. All you have to do is let them know as soon as you set it down just outside the door.
And I want to put in a plug for a lot of our local restaurants, locally owned, locally operated, are changing the way they do business, limiting the number of people inside, spreading out the tables, and doing a lot of takeout meals. So you place your order online, you drive through, they bring it out to your car, or you just go to the door and get it. And a restaurant owner I was talking to recently said, you know, we already follow a lot of health department guidelines for food. We wear gloves, we do, masks, all those things that help keep people safe. We know that restaurants are doing those things and maintaining very good sanitation practices.
Absolutely. Some that you might not typically think of as takeout or delivery. Restaurants are now expanding those options and or making them their only options. So if you want to know whether they're doing that, pick up the phone, call them. But many of our restaurants, we found in our small business contacts, are making those adjustments so that they can provide for pickup or delivery.
And I think, that's always a nice option for people. You get a little tired of your own cooking after a while if you're staying home, so it is an option that people can take advantage of.
And we definitely want to remember our small local businesses because they don't have the backing of a large national chain to help them weather through some of these storms. So if it is something that you are wanting to do, it's a good idea to think of our local businesses first.
Absolutely. The queue is empty at this point. Is there anything that anybody else wants to talk about?
Well, I will just say, as we ask the mayor to come up and close us out, then, that this is an evolving situation. As the chiefs both rightly mentioned, we can anticipate where we may end up with some of the other nations' experience, other states' experiences, but we are heeding their lessons and practicing more social distancing to flatten that curve I started out with. But even at that, we don't know what the future holds any time. And so as we get new circumstances, as we get new information, we will continue to update people. And that is your city team's commitment. We can take calls, we can answer things electronically, but we'll also try to do periodic chats of this nature so that we can keep the public informed.
In fact, I keep mentioning the Virginia Department of Health number, and again, that's 757-594-7069. But I have not mentioned that our own 311 call center is open. That's 311 from a landline if you're in Hampton, and 727-8311 if you're calling from a cell phone. Mayor?
And thank you to our panelists for their presentation, and thank you for your questions. As was stated earlier, this is a fluid situation that's continuing to evolve. As of 11:30 this afternoon, or this morning, there were 67 deaths in the Commonwealth of Virginia, 67 confirmed cases, and 2 deaths. Let me get that correct. While our public buildings, community centers are closed, we are still continuing to provide services, police, fire, and waste collection. We want you to, again, practice social distancing, not gather in groups of more than 10 people, and if you are gathered, to try and maintain 6 feet apart. Want you to still maintain contact and monitor us on our Hampton.gov and our social media. Thank you for joining us.